So let us talk about Mallory Weiss syndrome today. Mallory Weiss syndrome is defined as bleeding from laceration in the mucosa at the junction of esophagus and stomach. There are four key points: a vertical tear in the form of a laceration in the mucosa of the gastroesophageal junction because of forceful vomiting, which is just below the squamocolumnar junction, is defined as Mallory Weiss tear. Now, any patient who has developed multiple episodes of vomit will eventually develop number of lacerations in the squamocolumnar junction. They will bleed, and the patient could present either in the form of hematemesis or melena. Let me give you a better concept by showing this in the form of a diagram. Now, as you could see in this diagram, on one end there is esophagus, on the other end there is stomach, and the blue arrow is showing the squamocolumnar junction. Now, Mallory Weiss tear is a vertical tear that occurs just below the squamocolumnar junction of esophagus and stomach. Now, there are a number of causes: alcoholism, bulimia nervosa, NSAIDs overuse, hiatal hernia, and hyperemesis gravidarum. Bulimia nervosa is defined as binge eat followed by purging. By binge eat, we mean that there is a large amount of intake of food in a very short period of time, followed by self-induced getting rid of this food. Now, this is a psychotic eating disorder found in young females. There are two things that we must know regarding Mallory Weiss syndrome. Mallory Weiss syndrome presents as one of the etiology for upper gastrointestinal bleed. So the investigation of choice for that is an endoscopy. Endoscopy acts as a both therapeutic as well as diagnostic investigation. The management for this one or multiple episodes of acute vomit along with bleed is an endoscopic injection of epinephrine. Now, epinephrine is a vasoconstrictor drug. It will cause constriction of the blood vessels and it will stop the bleeding. Epinephrine is also used during surgery to create a bloodless surgical field. If in one patient this treatment plan has failed, we can progress to another step, that is embolization of the bleeding arteries as high gastrostomy. Now, an important point to understand is that there is a high pressure in the arteries which is causing this bleeding. So it will not be stopped by balloon dilatation. Now, the second step of management is to actually treat the cause which led to multiple episodes of vomit. If in case of this patient it is alcoholism, we will ask the patient to stop alcohol. But if our patient is diagnosed to have bulimia nervosa, we will provide our patient with cognitive behavioral therapy. We can ask the patient to avoid NSAIDs. If NSAID overuse is identified as the cause, then hiatal hernia, if it is identified as cause, we can provide surgical repair to that patient. In case of hyperemesis gravidarum, only fluids and metoclopramide will do the trick. Now, what is metoclopramide? It is a prokinetic drug which will increase the motility and that will allow easy passage of food and it will ease the stomach emptying. Another important thing that we must differentiate Mallory Weiss syndrome from Borjeev syndrome. Mallory Weiss syndrome can be classified by four terms: a vertical mucosal tear at the junction of esophagus and stomach. Borjeev syndrome, on the other end, is a transmural tear in the distal esophagus that leads to perforation, severe chest pain, and bleeding. Now, a typical sign for Borjeev syndrome is subcutaneous emphysema.